Well, global coronavirus cases now topping 15 million. This as President Trump is touting major progress in therapeutics. Listen.
Some of the therapeutics that we already have are really working well. And if I had my choice of vaccines or therapeutics, give me therapeutics every time, because I'd love to walk into a hospital and give everybody something and they start walking out in 2 days. That's what I'd like. Vaccine is very good longer term, but give me therapeutics, and we're doing really good work therapeutically.
To family physician Dr. Jennifer Caudle now. Jennifer, good to see you. We appreciate you being here. Thank you, doctor.
Thank you.
To the president's point, we have seen these infections surge in different parts of the country, in Florida and Texas, elsewhere. But we have also seen in the past month a decrease in what's called the observed case fatality ratio. That is the mortality rate for short, about a 20% drop, which is pretty dramatic. Is that because of therapeutics? Because even if you get the virus, which is a sorry state, there are better therapeutics to keep you alive.
Well, I think that decrease is due to a number of things. We do know that cases seem to have shifted towards younger people. That may be playing a role in that. We know that younger people, while susceptible, don't tend to get as ill as other people, though, yes, they can get very ill themselves. That may be playing a role into some of the decreased deaths that we're seeing. I would also remind us to be cautious, because deaths can lag behind other indicators. So the story is not entirely written. Of course, we hope that lower deaths remain, but I say we still need to wait and see. I would also argue, you ask about therapeutics, we're at a different place now in July than we were in April when we started this, and in March rather. February, March, April, we simply know more. We don't have all of the answers. We don't have all of the therapeutics we need by far, and we don't know everything, but we know more than we did then.
Yes, we do.
So some of that also probably has to do with being able to treat people a bit better than we could before. But overall, the fact that deaths are lower, while that's a good thing, does not make me feel like, oh, okay, we're done.
No. Of course not. But I don't want to be overly optimistic, but focusing on the positive, as you mentioned, we are capable of learning things, even if from something as complicated and perplexing as this new virus. And the treatment, for example, the protocols of treatment. We remember that there used to be tremendous cause for ventilators, use of ventilators and intubations, until we discovered that maybe in many of the cases that was actually accelerating death rather than preventing it.
Well, once again, this is something that we're still learning about every day. Every situation, every patient is different, but we have learned things, and that is the good thing. What we need, though, is we do need more therapeutics. We need more clinical trials. We need more data about medications that can be used, but we also do need a vaccine. I actually consider them equally as important in this landscape where we really have nothing truly definitive. So just as much as we are working on therapeutics and learning more about that, we do need this vaccine, and I'm glad to see that we are working at sort of top speed to try to get vaccine candidates to trials and to get something on the market as soon as is possible.
The president was ridiculed for saying a couple of weeks ago that we would get one by the end of the year, but it looks right now like we actually may, no?
I'm not sure that it's going to happen by the end of the year, and I'm not sure that I've heard many other physicians say that they think the end of the year it will happen. Look, at least the estimates that I have heard is, maybe 2021 and in the next year. We know that some vaccine candidates are entering into phase 3 trials right now this month. That is a good sign. But look, the point being is, we're cautiously optimistic that we will get something. The idea is the sooner the better, as long as it works. It's FDA approved. It's gone through the proper trials and protocols. But I would also say the other side to that is making sure that people can get the vaccine. As you mentioned, it seems like there's work done to try to make sure everyone can get that without cost.
Yes.
I just hope that people will take it when it does come out.
Yeah. Geez, I'm old enough to remember the polio vaccine and how everybody rushed to get one of those. So I'm hoping and I'm praying that it'll be the same this time with a vaccine for coronavirus. Doctor, thank you very much for being here. We appreciate it.